you love microneedling.
I do.
You are awesome at microneedling. Tell me about microneedling. Most people don't even know what that is.
So microneedling is a controlled micro injury. Okay, so I'm essentially taking a device and I'm creating a controlled puncture. Now the depth is going to vary on that puncture, right? Mm-hmm. So it depends on kind of what I'm targeting. Am I targeting just aging? Am I targeting pore size? Am I targeting acne scarring? So what am I looking to improve? Mm-hmm. So it's essentially running a tool, a pin across your skin and creating those controlled injuries. And I'm looking at how is the tissue responding? How is, am I getting the pinkness I want to get? I'm not trying to have you walk out of here bloody and dripping. That's kind of the old school way of thinking, mm-hmm. right? And again, when this came out years ago, we didn't really know.
Right.
Like anything in this industry, like Latisse, it was used for glaucoma patients. So you live and you learn.
Sure, of course.
And you kind of figure out what works and what doesn't work. And so the microneedling, I've had a lot of success with it. And you can, again, live your life. You have about a day to 2 days of being slightly red, but it's totally doable to go to work the next day. Again, as long as you're using the appropriate products afterwards and you're wearing your sunscreen. But I've really, really, really had great results with it. And I love, 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 love doing it.
That's awesome. So what kinds of problems or what kind of conditions, if someone walked in and sat in your chair, would you say you are the perfect candidate for microneedling?
A person who is looking for a really good rejuvenation treatment. Say they're 35 and they're like, my skin is I'm just looking for the biggest bang for my buck.
Huh?
A series of microneedling is going to be your best. I mean, that's a great way to see results. Now, again, you're going to have to put in your work and you're going to have to get inactive. You're going to have to invest in that at-home skincare stuff. But it's going to give you a really, really, really good result. And you want someone who's a professional to do this. You don't want to go on Amazon and buy a dermal roller and try to do it yourself.
Bacteria and...
You don't want to do that. That is a big no-no. You want someone who knows what they're doing, someone who knows what response they're looking for.
Right.
You don't have to go a 2 millimeter depth. You want that person to be like, okay, I'm happy with this endpoint. Let's move on. But a series of that is very important every 4 weeks. So once we start the treatment, I want to get you back in here in a month and then do at least three to six, depending kind of what I'm trying to achieve.
Sure. Sounds good. So let's just say somebody has like loss of collagen, saggy skin, mm-hmm. fine lines and wrinkles, acne scars. Mm-hmm. All of those would be very appropriate.
All of those would be very appropriate for microneedling, but a very different approach.
Right.
Right. So, acne scarring is going to be a much more aggressive treatment. Fine lines and wrinkles is going to be a little deeper than your rejuvenation. And again, that consistency, that getting to me every month for at least 3 sessions, again, 3 to 6, depending on what we're doing, is really crucial. Because again, one and done is not going to do it.
Unfortunately. Sad but true.
It is true.
For really anything.
For anything.
You couldn't hire a personal trainer and have one session and
anything.
Like a supermodel.
Anything in this world. It's good. It takes commitment. It takes consistency.
Mm-hmm.
And I think, again, just circling back to that importance of educating the patient and having that consultation and really explaining it to them in layman's terms. Right. And this is how it works. And this is what's good for you, because microneedling isn't for everybody.
Right.
Maybe a Linder Peel series is better. Maybe an IPL or Exion Clear is better for that patient. It just really depends on what we're trying to achieve, what we're talking about.
Sure. And sometimes blending things is important.
Yes.
So sometimes people might have some pigmentation that we want to add in some chemical peels. We can actually do those with the microneedling, right? In the whole blended series.
Correct.
And we would sit down and help them schedule the calendar, make sure it fits in their lifestyle and their budget, and have that informed conversation before we even embark
Absolutely.
on
And it may change.
Right.
You know, let's say we do, 2 needling sessions and I'm like, wow, we're good to go. Okay.
Yeah.
Well, then let's focus now on this.
Right.
So, it constantly evolves and changes.
Well, we're all exposed to gravity, environmental changes, stress, all that plays out on our skin.
Yeah, it does.